Nursing care of patients with bowel disorders. Diarrhea and constipation are two common complaints of the large intestine. Causes of diarrhea include infection of the lower tract and nervous stimulation, both moving feces more rapidly than normal, but also causing dehydration if prolonged. Diarrhea is a loose, watery stool. A person with diarrhea typically passes stool more than 3 times a day. People with diarrhea may pass more than a quart of stool a day. Acute diarrhea is a common problem that usually lasts 1 or 2 days and goes away on its own without special treatment. Prolonged diarrhea persisting for more than 2 days may be a sign of a more serious problem and poses the risk of dehydration. Chronic diarrhea may be a feature of chronic disease. Diarrhea can cause dehydration, which means the body lacks enough fluid to function properly. Dehydration is particularly dangerous in children and older people, and it must be treated promptly to avoid serious health problems. Borborygmi are loud, hyperactive bowel sounds. Hyperactive bowel sounds are an increase in sound and frequency. For those who are lactose intolerant, the lactose in milk is not broken down and absorbed. The lactose molecules exert an osmotic draw, which causes diarrhea. People who experience constipation have infrequent bowel movements, pass hard stools, or strain during bowel movements. When considered, normal frequency for bowel movements varies widely. If you pass fewer than 3 stools a week and the stools are hard and dry, then you may suffer from constipation. Fortunately, most cases of constipation are temporary. Simple lifestyle changes such as getting more exercise and eating a high-fiber diet can go a long way toward alleviating constipation. Constipation may also be treated with over-the-counter laxatives. Normally, the waste products of digestion, the stool, are propelled through the intestines by muscle contractions. In the large intestine, also known as the colon, most of the water and salt in this waste mixture are reabsorbed because they're essential for many of the body's functions. However, when the colon absorbs too much water, or if the colon's muscle contractions are slow, the stool becomes hard and dry and passes through the colon too slowly. This is the root cause of constipation. The patient may also experience constipation if the muscles used to move the bowels aren't properly coordinated. This problem is called pelvic floor dysfunction, anismus, and it causes the patient to strain with most bowel movements, even soft ones. Irritable bowel syndrome. Although a stool softener such as docusate colace may be prescribed, it is important to note that laxatives can further increase intraluminal pressure in the colon and should be avoided for the patient with diverticulitis disease. Irritable bowel syndrome is a common disorder that affects the large intestine. Irritable bowel syndrome commonly causes cramping, abdominal pain, bloating, gas, diarrhea, and constipation. Despite the uncomfortable signs and symptoms, irritable bowel syndrome doesn't cause permanent damage to the colon. Many people with irritable bowel syndrome find that symptoms improve as they learn to control their condition. Only a small number of people with irritable bowel syndrome have severe signs and symptoms. It is not known exactly what causes this. The walls of the intestine are lined with layers of muscle that contract and relax in a coordinated rhythm as they move food from the stomach through the intestinal tract to the rectum. Patients who suffer from irritable bowel syndrome, the contractions may be stronger and last longer than normal. Food is forced through the intestine more quickly, causing gas, bloating, and diarrhea. In some cases, the opposite occurs. Food passage is slow and stools become hard and dry. Abnormalities in the nervous system or colon also may play a role, causing the patient to experience greater than normal discomfort when the abdomen stretches from gas. Fecal incontinence is the inability to control the bowel movements, causing the stool to leak unexpectedly from the rectum. Also called bowel incontinence, fecal incontinence ranges from an occasional leakage of stool while passing gas to a complete loss of bowel control. Common causes of fecal incontinence include constipation, diarrhea, and muscle or nerve damage. Fecal incontinence may be due to a weakened anal sphincter associated with aging or to injury to the nerves and muscles of the rectum and anus from giving birth. Critical to normal bowel function are anal sphincter muscles. External and internal anal muscles contract to prevent stool from leaving the rectum. Rectal sensation. This feeling warns you to go to the bathroom. Rectal accommodation. The rectal stretching allows you to hold stool for some time until you can get to the bathroom. The ability to hold stool requires a normal function of the rectum, anus, and nervous system. Also, the patient must have the physical and mental capabilities to recognize and appropriately respond to the urge to defecate. If something is wrong with any of these factors, fecal incontinence can occur. Hernia. Although indirect inguinal hernias are congenital defects, they often are not evident until adulthood, when increasing intra-abdominal pressure and dilation of the inguinal ring allow abdominal contents to enter the channel. Direct inguinal hernias are acquired defects that result from weakness of the posterior inguinal wall. Direct inguinal hernias usually affect older adults. Femoral hernias are also acquired defects in which a peritoneal sac protrudes through the femoral ring. An epigastric hernia occurs below the rib cage and above the navel along the midline of the abdomen. Intestinal obstruction is a blockage of the small intestine or colon that prevents food and fluid from passing through. Intestinal obstruction can be caused by many conditions, but it's most often the result of fibrous bands of tissue in the intestine called adhesions, hernias, or tumors. Intestinal obstruction can cause abdominal pain and swelling, nausea, and vomiting. If left untreated, intestinal obstruction can cause the blocked parts of the intestine to die, become necrotic. This tissue death can lead to perforation of the intestine, severe infection, and shock. With prompt medical care, intestinal obstruction can often be successfully treated. Many conditions can cause intestinal obstruction. The causes often differ depending on whether the obstruction occurs in the small intestine or in the colon. Mechanical obstruction occurs when something such as a hernia or tumor is physically blocking the intestine. Blockage of the intestine can be partial or complete. Paralytic ileus pseudo-obstruction, a condition in which the intestines don't function properly, may have the same signs and symptoms as mechanical obstruction, but no physical obstruction is present. Atonic is a term used to refer to the loss of muscular tone. In adults, adhesions develop following abdominal surgery or inflammatory processes. Adhesions usually produce a simple obstruction or single blockage in one portion of the intestine. Diverticulitis. The colon is a long tube-like structure that stores and then eliminates waste material. Pressure within the colon causes bulging pockets of the tissues, or sacs, that push out from the colonic walls as a person ages. A small bulging sac pushing outward toward the colon wall is called a diverticulum. More than one bulging sac is referred to as diverticula. Diverticula can occur throughout the colon, but are most common near the end of the left colon, called the sigmoid colon. The condition of having these diverticulae in the colon is called diverticulosis. A patient with diverticulosis may have few or no symptoms. When a diverticulum ruptures and becomes infected, the condition is called diverticulitis. A patient suffering from diverticulitis will have abdominal pain, abdominal tenderness, and fever. When bleeding originates from a diverticulum, it is called diverticular bleeding. A patient who suffers the consequences of diverticulosis in the colon is referred to as having diverticular disease. Hemorrhoids. Hemorrhoids are enlarged veins located within tissues of the lower portion of the rectum and anus. Water and fiber in the diet can prevent constipation where the feces become too dry and hard. Hemorrhoids are enlarged and inflamed blood vessels at the anus. This condition is associated with chronic constipation. Regular elimination reduces the time the colon wall is exposed to cancer-promoting agents in the feces and may help prevent cancer. Hemorrhoids are much like varicose veins you might see on a person's leg. When bulging hemorrhoidal veins are irritated, they cause surrounding membranes to swell, burn, itch, become very painful, and bleed. The anorectal junction separates the rectum from the anal canal and may be the site of internal hemorrhoids. Hemorrhoids are caused by too much pressure in the rectum, forcing blood to stretch and bulge the walls of the veins, sometimes rupturing them. Causes of hemorrhoids: constant sitting, straining with bowel movements from constipation or hard stools, diarrhea, sitting on the toilet for a long time, severe coughing, childbirth, and heavy lifting.